Clinical examination of the musculoskeletal system. The knee joint. The knee is also essentially a hinge, biomechanically a very complicated one, with a moving axis and allowing some rotation in the longitudinal plane when flexed. There are actually three joints, one between each femoral and tibial condyle, and one patellofemoral. In addition, the presence of menisci introduced a whole new range of pathology. Injuries to the knee are common, and it's particularly important to ask about any possible trauma. So remember also that the symptoms may be referred from the hip. The symptoms referred to the knee joints are pain, stiffness, instability, and giving way. The pain distinguish between constant pain, as in synovitis, and pain on weight bearing, as in damage to the joint surface. Localization of pain is very important, and patellofemoral arthritis needs quite different treatments to that arising from the femoral tibial joints. Injuries to structures with the blood supply cause hematosis, which appears within minutes, and this includes ligamentous, ligamentous tears, and fractures. Injuries to the avascular menisci produce a synovial effusion, which takes an hour to develop. Bruising particularly indicates damage to a vascular structure, but may be simple due to contusion of the skin and subcutaneous tissues. Okay, let's look at stiffness. The limitation of both flexion and extension are common in the arthritic knee. So loose bodies and torn menisci cause locking. A sudden block to full extension followed by sudden unlocking, usually after some manipulation or twisting movement by the patient, is very common. So instability, that's giving away or giving way. The knee joint has no inherent stability. The two surfaces are only held in their normal relationship by the cruciate and collateral ligaments, and injuries to which cause various complex types of instability. Even if the ligaments are intact, the quadriceps must contract powerfully to keep the knee straight during the stance phase of gait. And this muscle waste within a few weeks of the onset of knee problems may give way, as so that the knee may give way, that is flex when it should not have flexed, and this may cause the patient to fall down suddenly. Patients with long-standing paralysis of the quadriceps due to poliomyelitis develop hyperextension of the knee and are able to stabilize it in that position, the strain being taken by the posterior capsule.